Hi, I'm Dr. Scott. What I'm talking today about is blood sugar. Now, I'm going to be covering the basic principles of how blood sugar is regulated, insulin resistance, diabetes, what hormones are involved. And mainly I'm doing this because I think there's a big confusion with how the blood sugar is regulated, what things we can do to help with this regulation. And especially for the current patients that are seeing me. That way, when I tell you what foods to eat, what not to eat, how often, that kind of a thing, you have a better understanding of why we're telling you what we're telling you. Okay? All right, so let's start with this. Now, everything that we eat gets turned into sugar. All right, whether it's a Big Mac, whether it's a steak, whether it's chicken or that kale or broccoli, everything gets turned into sugar. Now, some foods get turned faster into sugar than others. And that's where we come up with what they call the glycemic index. This is an index that basically puts a rating on all foods, and it's based upon how fast they're turned into sugar. Okay? So, what I have up here is this. Let's say we go out and we eat a meal. This is a combo meal. This combo meal gets turned into sugar. All right? Now this sugar gets absorbed into the bloodstream and then it floats around in the bloodstream. Now within the bloodstream, the sugar that's there, the body cannot use it for energy, because that's what it's going to be using the sugar for, is to use it for energy and to run the different processes in your body. So the only sugar that is usable by the body is the sugar that's in the cell. So when you eat this combo meal and then you get this absorption, all the sugar that's in your blood, the body wants to get that sugar as quick as possible, converted or turned or put into the cell as quick as it can. Okay? Because it needs the energy. And the sugar that's floating in your bloodstream that's not in your cell, that is considered like battery acid. It's like little shards of glass that are floating around in your system, which is very, very toxic and a very bad situation. So when we're doing your blood checks, you know, if you're doing your pinprick and checking your blood sugar, your glucose levels, that's what you're basically measuring, is the blood that's not, the sugar that's not in the cell. Okay? Now, your blood sugar, your glucose level should be 85 to 99 on your lab work, and your A1C test should be below 5.6. Now this A1C test is the average of the last 3 months of what your blood sugar was. One of the best and most sensitive markers for blood sugar is the A1C test. Now, we have the sugar that's floating around in your bloodstream. Now, the sugar itself cannot get into the cell by itself. It needs a chaperone. The chaperone in your body is called insulin. Okay? So what happens is, kind of like my daughter, if she wants to go to the prom, the administrators of the high school decided that they need to have a chaperone. They needed a parent present. So she goes to the school without me or my wife, right? She goes to the school without a chaperone, and the administrators turn her away and say, "I'm sorry, come back with a chaperone." That's what happens with the cells in your body. They have these little receptors, and it's almost like a lock and a key. If insulin's not present, it's not accepted. Okay, so that is the role of insulin. The insulin is basically the chaperone to bring the sugar into the cell. So, let's say you eat a meal, turns to sugar. Now the body needs the insulin to start getting produced. Now remember, insulin is produced by your pancreas. Okay? Now, you eat the food, the pancreas kicks out insulin, and instantly the insulin is trying to get the sugar out of the cell, out of the blood into the cell. Now, with all these remaining globules or molecules of sugar that are left over is that battery acid. Now, what will happen is, let's say you eat breakfast. You have pancakes, you have some sugar, you have the donuts, and your blood sugar spikes up. Now the body goes as fast as it can to try to get the sugar out of the bloodstream into the cell. So it gets the insulin and gets it going. And it takes all that time to get the blood sugar to finally kind of drop back down. And all of a sudden, you eat again. You have lunch, a big meal again, and it kind of goes through this roller coaster. So what happens? Your body finally gets tired. The pancreas gets tired. These receptor cells for insulin start going, man, you are here all the time. You know, because you're constantly, the insulin is being produced at a high rate because it has to take all the sugar into the cells, that these receptor sites, to protect themselves, they get desensitized. They actually kind of withdraw and they stop listening to insulin. That's how you get insulin resistance. So it's kind of like there's an old show called Lucille Ball. And she had an episode where she was in this chocolate factory and she was taking these chocolates and she was stuffing them, not stuffing them out, sorry. She was in the chocolate factory. She had to take the chocolate and put the chocolates into the box, right, to package them. And it was kind of going on a nice, slow pace, and she kept doing it. But over time, the conveyor belt with the chocolate started going faster and faster. So she was just going as fast as she possibly could, and guess what? She couldn't keep up. So she started stuffing the chocolates in her mouth, putting it in her pockets. You know, it was a really funny show. But I use that example because that's what happens with your body when you have constant spikes of blood sugar. Because the body just can't keep up. You just have constant flow of blood sugar and it's just doing whatever it can. And then you have all this insulin laying around and then it gets resistant to it. And then over time, if you stay in that state, you become a full-blown diabetic. Okay? Now, diabetes isn't really diagnosed until about 126 on your blood work. So you have this big range here of where this is called insulin resistance, okay, or pre-diabetes, okay? So if you're higher than 99, that's a problem. If you're lower than 85, that also is a problem, okay? Now, another hormone I want to talk about is cortisol. Cortisol is a stress hormone, and the number one function or purpose of cortisol is to raise your blood sugar. So, for example, if you see a bear, right, your cortisol levels are going to go up because you're going to need some quick energy fast because you're either going to fight the bear or you're going to run from the bear. So this cortisol, right, if you're under a lot of stress, your cortisol goes up and that will immediately raise your blood sugar. So if you want to regulate your blood sugar properly, you've got to be able to manage your cortisol levels. Now, this cortisol hormone is actually a dynamic hormone, which means it doesn't secrete the same amount throughout the whole day. What should happen is actually your cortisol level should be high in the morning, so you should wake up ready to go. And then it slowly throughout the day lowers and then kind of is totally low right before you go to bed, so you can go to sleep and sleep like a baby. Okay? Well, that's cortisol. Now, if you get out of this rhythm, right, maybe you're spiking or whatever it is, you're going to have some blood sugar problems. Now, some of our patients, all we have to do is manage that cortisol balance, and magically their blood sugar seems to balance out. Now, not all of them. Some of them have other issues in the system, but that is cortisol. Now, if cortisol gets out of balance, not only will it raise your blood sugar, it will mess up your thyroid function. It will give you sleep pattern losses, basically insomnia. It can give you, have a hard time going to sleep, or do you stay asleep? It'll mess up your short-term memory. There's a lot of things that can go wrong with this cortisol, and we check that by doing not a blood test, but a saliva test. Okay. This is the basics of your blood sugar regulation. Hopefully you got some more information and more understanding on this particular topic.